Hello, welcome to my animation videos. My name is Dr. Julian De Silva and I'm a London-based facial, cosmetic and plastic surgeon, and I only complete surgery on the face. Today I'm talking to you about an animation video on chin implant surgery and how the procedure is performed. The aim of this animation is to give you an insight into the intricacy and the anatomy in which a chin implant is inserted, to give you an idea of what are realistic expectations from the surgery, and to give you a better understanding on how the procedure is performed and how to get the best possible result. When considering having a chin implant, there are a number of factors that are particularly important when considering the procedure. Firstly, sizing of the implant, and this is a very important discussion between you and your surgeon to discuss your expectations from the surgery. And I personally take into account a person's shape of the chin, the size of their chin, the characteristics of your face, your body shape. All of these are particularly important when determining what the best size of implant is for you. I personally keep every size of implant and use sizing implants in the surgery to determine what looks best, bearing in mind each individual patient's expectations and the actual measurements of their chin. Other characteristics of the scar, well, it's important that any scar from chin implant surgery is discreet, and generally the scar is less than 1.5 centimeters and sits parallel to a natural crease under your chin. And although this may be a little bit pink immediately after the surgery, with time and taking the right precautions, that will heal to a fine line that is difficult to see. The other characteristic is customization of the implant. I personally customize every implant to match a patient's natural jawline and also an individual's requirements. And I personally use silicone implants that can be very straightforwardly shaped to match a patient's jawline, and this is particularly important for certain individuals, particularly women who might want to have a more heart-shaped and more feminine chin and jawline. Well, this requires shaping of that implant nearly or up to 50% of the implant can be shaped in order to give a more feminine and natural augmentation of the chin. The other characteristic is movement, and everything is fighting against gravity, and with time, over a period of months and years, an implant can be encouraged to drop down and can sit beneath the jawline. I personally am proactive in preventing this, and when I complete chin implant surgery, I place 2 small 10mm titanium screws that ensure that the chin implant will not only stay in the correct position but will last lifelong in terms of that position and will not change with time or the effects of gravity. In terms of the scar, well, it's important that any scar is discreet and difficult to see, and important to this is encouraging any scar to be a fine line that is difficult to see. And to achieve this, I use a 3-layered stitch approach that ensures that there's no tension on that scar, and it's really tension that can give rise to a larger or wider scar. The proportion of patients that can have difficulty with scarring and healing is really less than 1%. So the great majority of patients heal very well, and taking the right precautions, scars are very, very difficult to see. I hope this information has been useful for you. Thank you for watching.